Welcome to Learning Anatomy with Dr. Bakari. In this lecture, we'll be looking at the cardiac veins. I have done a lecture on the coronary arteries through which oxygenated blood reaches the heart tissue. You can go and check that lecture up to keep yourself updated. But for the purpose of this lecture, we'll be looking at the venous drainage of the heart tissue through which venous blood or deoxygenated blood is drained from the heart. We said that the cardiac veins help to drain venous blood from the heart. They help to remove deoxygenated blood from the heart tissue itself. So if you look at this image here, this is the external feature of the heart. Before this drainage, it needs to be supplied with oxygenated blood, and this is done through the coronary arteries. So this is one of the coronary arteries here, highlighted in red. And after supplying the heart tissue with oxygenated blood, the heart will use up the oxygen content in the blood to carry out its own metabolic activities, after which the remaining blood will become deoxygenated, and this will be collected through the cardiac veins. And these are the cardiac veins here highlighted in blue. So you can see that on the surface of the heart, you have the coronary artery, which helps to supply oxygenated blood to the heart tissue, and you have the venous blood being collected through the cardiac veins, and this is what is highlighted in blue. For the venous drainage of the heart tissue, it takes up three routes. The first route, and also the major route, through which the majority of the cardiac veins will drain through, is the coronary sinus. From the coronary sinus, it is then further collected or drained into the right atrium. This is where most of the cardiac veins drain into. This is the major part of the venous drainage of the heart. This is the configuration of the heart here. We know that all venous blood are collected into the right atrium. This is the right atrium, after which it is then pushed into the right ventricle, before it is then pushed into the pulmonary artery that will take the deoxygenated blood into the lungs, where it will be oxygenated. After the oxygenation of blood, it will then be delivered back into the heart. This I have explained in a previous lecture on the heart. You can also go and check that lecture up to keep yourself updated. Another route through which the venous drainage of the heart can go is through the anterior cardiac veins. And from the anterior cardiac veins, the venous blood will be drained also into the right atrium. You can see that the right atrium is like the final target of the venous blood. And the last route through which the venous blood can be collected is through the Thebesian veins. From the Thebesian veins, this venous blood will then be drained into all the chambers of the heart. So these are the three basic routes through which the venous blood of the heart will be collected. So we are going to be taking each of these routes one after the other to see where they pass through and where they will be finally drained into. So let's go through the coronary sinus first, which is the major part of venous blood collection before it is finally delivered into the right atrium. So the coronary sinus is the largest vein of the heart. The coronary sinus is seen to run transversely through the left posterior atrioventricular groove. So you see the coronary sinus at the posterior part of the heart. This is the posterior presentation of the heart. And this is where we have the coronary sinus. You can see that out of all the veins of the heart, the coronary sinus is what is seen to be the largest. And this is what is harrowed here in yellow. The coronary sinus is seen to pass through the left posterior atrioventricular groove. The left posterior atrioventricular groove, all we need to do is break down the names, which means that it is on the left part and also at the posterior part. And of course, it is a groove that is created between the left atrium and also the left ventricle. This is the left atrium here, and this is the left ventricle. We already said that the left atrium is seen at the posterior part of the heart. So this is the posterior configuration of the heart, and this is the left atrium. And inferior to that, we have the left ventricle. In between these two chambers is where we have the left posterior atrioventricular groove, where the coronary sinus will pass through before it is finally directed into the right atrium, where the deoxygenated blood will be collected and will be further delivered to other regions of the heart. So this is where we have the coronary sinus passing through the left posterior atrioventricular groove or the posterior coronary sulcus. The left posterior atrioventricular groove is also referred to as the posterior coronary sulcus because it allows for the passage of the coronary sinus. This groove is created to allow for the passage of the coronary sinus, and that is why it is also referred to as the posterior coronary sulcus. And finally, as it runs around this space, you see that it is directed into the posterior wall of the right atrium. So using this image down here for illustration, this is where we have the right atrium. This is the chamber. It is opened here. So this is the right atrium where the deoxygenated blood from the coronary sinus will be delivered into. So in this image here, the right atrium is opened because the smooth anterior part is cut up, and that is why we can see the smooth posterior part. So if you go through the smooth posterior part, at the lower part of the smooth posterior part is where you have the coronary orifice. You can go and check up my lecture on the right atrium. We've tried to describe the rough anterior part and also the smooth posterior part in that lecture. In the anterior part of the right atrium is where we have the rough part, while in the posterior region of the right atrium is where we have the smooth part. So the part that is exposed in this image here is the smooth part and is at the posterior part. So it is the smooth posterior part that is seen in this image. So if you trace it down at the lower part of the smooth posterior part is where you have the coronary orifice. So as the coronary sinus is seen to pass through from the posterior part of the heart, you see it coming out at this region, and this is where it finally opens up into the right atrium. At this point where it opens into the right atrium is referred to as the coronary orifice. This coronary orifice is seen between the tricuspid valve. This is the tricuspid valve, the valve that separates the right atrium from the right ventricle, and also the opening of the inferior vena cava, and this is the opening of the inferior vena cava arrowed here. So you see the coronary orifice in between the tricuspid valve and also the opening of the inferior vena cava. So this is where we have the opening of the coronary sinus, which finally will deliver the deoxygenated blood into the right atrium. And from the right atrium, it will be taken down into the right ventricle. From the right ventricle, the pulmonary artery, which is the only artery in the body that carries deoxygenated blood, will then carry this blood and deliver it into the lungs where it will be oxygenated. So that is the presentation that is seen around this region. Also to add that the coronary orifice, which is the opening of the coronary sinus into the right atrium, is being guided by a valve that is called the Thebesian valve. The Thebesian valve is to prevent the reflux or the backflow of deoxygenated blood into the coronary sinus. So this is like a guide that is helping to direct the path of deoxygenated blood into the right atrium, so as to prevent the backflow of blood into the coronary sinus. This Sebastian valve is an embryonic remnant of sinoarterial valve, and it is seen as a membranous fold created around the opening of the coronary orifice in the posterior wall of the right atrium. So it's also good for us to know this. So now going further on the tributaries of the coronary sinus. The coronary sinus, we said that it is the largest vein that collects deoxygenated blood in the heart. But there are tributaries, which means that there are other veins that are seen to drain into the coronary sinus. And this is the coronary sinus here. The coronary sinus, in our previous slide, we've already explained that it is located at the left posterior atrioventricular groove, and that is why it is represented here with dotted line. So it is seen at the posterior part of the heart. So this is what is arrowed here in red. So if you look at the coronary sinus at the posterior region of the heart, you see that there are other veins that are seen to drain into it, and these are called the tributaries. And after the deoxygenated blood is collected into the coronary sinus, it will now be directed or delivered into the right atrium. And this is the right atrium here. From the right atrium, we know that it will go to the right ventricle, then the pulmonary artery, which will now deliver the deoxygenated blood into the lungs. So let's go to the tributaries of the coronary sinus, which are the branches or the venous branches that delivers deoxygenated blood directly into the coronary sinus before it is then taken into the right atrium. So the first one is the great cardiac vein. Then we have the middle cardiac vein, we have the small cardiac vein, we have the posterior cardiac vein of the left ventricle, we have the oblique vein, and finally we have the left marginal vein. So these are the veins that are seen to drain venous blood directly into the coronary sinus before the coronary sinus then take the venous blood into the right atrium. So let's take each of these branches one after the other to see the path or the course that they take around the heart. Let's look at the great cardiac vein. It's one of the tributaries of the coronary sinus, and it is the largest tributary of the coronary sinus. From the name, the great cardiac vein, which means it is large. And this is the anterior interventricular vein. This is the great cardiac vein or the anterior interventricular vein. From the name, it means it is in the anterior part and also located within the interventricular groove. This is the right ventricle, this is the left ventricle. So the groove that is created between the right and the left ventricle is called the interventricular groove. And this is where the anterior interventricular vein, which is also referred to as the great cardiac vein, will pass through. So the great cardiac vein, you see it beginning from the apex of the heart, and you see it ascending up and running towards the left side of the heart. This is the right side of the heart, this is the left side of the heart. As it gets to the left border of the heart, you see it turning to the posterior part of the heart. So you see it turning to the posterior surface of the heart. And from this posterior region of the heart, you see that it is being represented with dotted line. Just for us to be able to understand the part easily. So when they pass through the anterior surface of the heart, it's going to be represented with blocked lines. And when they turn to the posterior part of the heart, it's going to be represented with dotted line. So if you look at it in the anterior part, the line here is blocked. Around the left border of the heart to the posterior surface of the heart, it is then represented with dotted line. And if you see where it passed through here, it finally opens into the left region or the left side of the coronary sinus. We already said that this is the coronary sinus here. So you see the great cardiac vein or the anterior interventricular vein running from the apex of the heart, then directed towards the left side of the heart before it finally curves to the posterior surface of the heart, where it is then finally emptied into the left side of the coronary sinus. So you can see the interesting part of the great cardiac vein. And this is the point where it turns to the posterior surface of the heart. The great cardiac vein or the anterior interventricular vein is seen to accompany the anterior interventricular artery or the left anterior descending artery. Remember, we talked about this artery in our previous lecture on the coronary circulation. We said that this artery is seen to pass through the anterior interventricular groove. The corresponding named vein is seen to accompany this artery. So the great cardiac vein or the anterior interventricular vein is seen to be accompanied by the anterior interventricular artery or the left anterior descending artery. Also to add that we have the left marginal vein. This is the left marginal vein. Here you see it along the left marginal border of the heart. There is an interesting part of the left marginal vein. This left marginal vein, you can see it running at the posterior side of the heart around the left marginal border of the heart. And as it gets to this point, it could either be drained into the great cardiac vein at this level, and this is where it drains into the great cardiac vein or the anterior interventricular vein, or it may alternatively be drained directly into the coronary sinus. And this is the part where it drains into the coronary sinus. Where it drains directly into the coronary sinus will be discussed as one of the tributaries of the coronary sinus that we will get to as we go further with this lecture. But it's just for us to highlight at this point that the left marginal vein can be drained into the great cardiac vein or the anterior interventricular vein. So the great cardiac vein or the anterior interventricular vein can also receive venous blood from the left marginal vein, just for us to know this, even though it can also be drained directly into the coronary sinus. And that we'll discuss as a tributary of the coronary sinus when we get to that point in this lecture. So the second cardiac vein that is also seen as a tributary of the coronary sinus is the middle cardiac vein. The middle cardiac vein is the posterior interventricular vein, and this is the posterior interventricular vein here represented with dotted line because it is seen at the posterior part of the heart, also passing through the posterior interventricular groove. This is the right ventricle, this is the left ventricle. So the groove that is created between the right and the left ventricle at the posterior side is the posterior interventricular groove, and this is where the posterior interventricular vein, which is also the middle cardiac vein, passes through. You can see it running up here before it is finally released into the right side of the coronary sinus. Remember when we talked about the great cardiac vein, we said that the vein is emptied into the left side of the coronary sinus because of the path or the course that it runs But talking about the middle cardiac vein, now you see that it is drained into the right side of the coronary sinus at this point. You can see that the position where they also drain into in the coronary sinus is different. And this is because of the path that they run around the heart. And what accompanies the posterior interventricular vein is the posterior interventricular artery, just as the name implies, or the posterior descending artery, PDA. We've also discussed this artery in our previous lecture on the coronary artery. You can go and check that lecture up to keep yourself updated. So what accompanies the middle or the posterior interventricular vein is also the posterior interventricular artery or the posterior descending artery. And if you look at the path by which it runs, it is seen to pass through the posterior interventricular groove before it is finally released into the right side of the coronary sinus. So it is on the right side of the coronary sinus that the posterior interventricular vein will empty the deoxygenated blood into. Going to the third tributary of the coronary sinus is the small cardiac vein. The small cardiac vein is just a single vein, and you see it beginning around the inferior part or in the inferior border of the heart, just at the region where we have the anterior atrioventricular groove. This is the right atrium, this is the right ventricle, this is the right atrioventricular groove. So at the lower part of the right atrioventricular groove is where you have the small cardiac vein. And at this point, you see it turning to the posterior surface of the heart also. And as it turns onto the posterior surface of the heart, it is then represented with dotted line here, as you can see. And it's also passed through the right posterior atrioventricular groove. This is the right posterior atrioventricular groove at the posterior part before it is finally released into the right side of the coronary sinus. So it also empties blood into the right hand of the coronary sinus, just as what is presented in the middle cardiac vein or the posterior interventricular vein. So it empties deoxygenated blood into the right end of the coronary sinus. And this is the coronary sinus here, arrowed in yellow. It's also important to add that we have the right marginal vein. Remember, we talked about the left marginal vein at the left marginal border of the heart that can either drain its deoxygenated blood into the great cardiac vein or the coronary sinus directly. We also have the right marginal vein. This right marginal vein is also seen at the right marginal border of the heart. It can also empty its deoxygenated blood either into the small cardiac vein. This is the point where it releases the deoxygenated blood into the small cardiac vein here, or it can also release the deoxygenated blood that it is carrying into the right atrium. So it can release it directly into the right atrium, or it may release it into the small cardiac vein. So it's good for us to note this. So the right marginal vein will not be discussed as part of the tributaries of the coronary sinus because it does not drain its venous blood into the coronary sinus. It could either drain it into the small cardiac vein or collect it directly and drain it into the right atrium. So that is what the right marginal vein presents. So the next tributary that I'll be talking about is the posterior cardiac vein of the left ventricle. Just as the name implies, it's seen at the posterior part, and it is the venous drainage of the left ventricle. This is the posterior cardiac vein of the left ventricle. This is the left ventricle around this region, and it is seen at the posterior part of the left ventricle, and that is why it is represented with dotted line. So from the posterior cardiac vein, you see its blood is then further delivered into the coronary sinus at this point here. The posterior cardiac vein, you see it located left to the middle cardiac vein. This is the middle cardiac vein or the posterior interventricular vein that we highlighted in our previous slide. This is the vein here, and you see the posterior cardiac vein of the left ventricle located at the left side of the middle cardiac vein. So this is the right side of the heart, this is the left side of the heart, and this is the posterior cardiac vein of the left ventricle. You see it located at the left side of the middle cardiac vein, and this here highlighted in blue is the middle cardiac vein. So you can see the relationship between the middle cardiac vein and also the posterior cardiac vein of the left ventricle. In case we are asked during exam, should be able to place or state where they are placed. And this is the middle cardiac vein that is harrowed here in yellow. And we have the posterior cardiac vein of the left ventricle here harrowed in red. And the next tributary of the coronary sinus is the oblique cardiac vein of the left atrium. Just from the name, that means it is the venous drainage of the left atrium. And we know that the left atrium is located at the posterior part of the heart. So it helps to drain the posterior wall of the left atrium. and this is the left atrium. The oblique cardiac vein of the left atrium is also referred to as the oblique vein of Marshall. So you see the oblique cardiac vein of the left atrium here arrowed in red, and you see it descending to be released into the coronary sinus. So it is also one of the tributaries of the coronary sinus. And where it drains is the posterior wall of the left atrium. So it collects venous blood from the posterior wall of the left atrium and it delivers it into the coronary sinus. So this is also one of the tributaries of the coronary sinus. Then the next tributary is the left marginal vein. Remember, we talked about the left marginal vein in our previous slide when we described the great cardiac vein. We said that the left marginal vein can also be seen to drain into the great cardiac vein, or can be seen to be drained directly into the coronary sinus. And we'll be talking about the left marginal vein as one of the tributaries of the coronary sinus with this slide. And this is where it drains directly into the coronary sinus. So when we have the left marginal vein, there's the left marginal vein that is seen to pass along the left marginal border of the heart, and you see this vein running along the left lateral wall of the left ventricle, where it drains this region and of course delivers the blood into the coronary sinus. And we've explained before that the left marginal vein is not seen at all time to be drained into the coronary sinus. It may also be seen to be drained into the great cardiac vein. We've described this in our previous slide, and we are highlighting the left marginal vein as a tributary of the coronary sinus with this slide because it is presented here to drain directly into the coronary sinus. So it's good for us to be able to establish this variation. This left marginal vein can also be referred to as the left obtuse marginal vein. The next venous drainage part of the heart is the anterior cardiac vein. We've described the coronary sinus and its tributaries, and that is the major part through which the venous blood of the heart will be drained. The second part through which the venous blood of the heart can also be collected into the right atrium is through the anterior cardiac vein. The anterior cardiac vein is seen in the anterior surface of the right ventricle, and they are usually about 2 to 3 or sometimes even 4 in number. And these are the anterior cardiac veins here arrowed in red. You see it at the anterior surface of the right ventricle where they drain. And of course, you see that the deoxygenated blood is delivered directly into the right atrium. These anterior cardiac veins are not seen to drain deoxygenated blood into the coronary sinus. It's seen to collect or drain the deoxygenated blood directly into the right atrium. And this is what is highlighted here in green and arrowed in red. So you see that the anterior cardiac vein drain deoxygenated blood directly into the right atrium, and the region of the right atrium where they drain this deoxygenated blood into is the anterior rough part of the right atrium. We've also done the lecture on the right atrium. We know that the right atrium will have the anterior rough part and the posterior smooth part. It's also good for us to be able to establish this in case we're asked during examination, that the anterior cardiac veins, of course, we know they drain the anterior surface of the right ventricle, but these veins are collected specifically into the anterior rough part of the right atrium. Then the last part through which venous blood can be collected in the heart tissue is through the Thebesian veins, or the smallest cardiac veins. This is also referred to as the venae cardis minimi. So the Thebesian veins are seen in all the chambers of the heart. They are the smallest cardiac vein. They are valveless, and this should not be confused with the small cardiac vein. The small cardiac vein is just a single vein that is seen to emerge at the lower border of the heart that we have discussed in our previous slide. But the Thebesian veins are smallest cardiac vein, smaller than the small cardiac vein, and they are seen in the 4 chambers of the heart, and this is what is arrowed here in black. So these smallest veins are seen to drain deoxygenated blood from all the 4 chambers of the heart, and where they drain this blood into is in their respective chambers. Thebesian veins in the right atrium draining the deoxygenated blood into the right atrium. You see the Thebesian vein in the right ventricle also draining the deoxygenated blood into the right ventricle. So you also see this kind of presentation also on the left side. So what the Thebesian veins do is that they drain the deoxygenated blood directly into the respective chambers of the heart that they are seen to be located. Also, for us to add that on the wall of the right atrium, we have the maximum number of Thebesian veins. And this is logical and also understandable because the venous blood or the deoxygenated blood is normally drained into the right atrium. And that is why you see that the wall of the right atrium is seen with the highest number of Thebesian veins. Just for us to also know this in case we are asked during examination. So let's check our understanding of this lecture through the following question. The first one is to explain the general or the major venous pathway of the heart. The second question is, what are the tributaries of the coronary sinus? The third question is, dash veins drain deoxygenated blood directly into the right atrium. We've tried to highlight the veins that drain their deoxygenated blood directly into the right atrium during the course of this lecture. And the last question is, describe the Thebesian veins. So thanks for watching. Let's meet again.